Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, I like to thank Alchem and all the sponsors and here who have arranged this kind of sessions. So see, these kind of sessions are
Yeah.
very much necessary for common people. We see patients in individual basis, but it is not possible for us to spread this kind of awareness messages throughout this common people. So, epilepsy is not a disease of a person, it's a disease that involves everyone in the society. So, there is a patient of epilepsy, and not only the patient suffers, the family members and the relatives also is involved along with the patient. So, there must be some kind of message that should be spread throughout the society so they can have a general awareness of this kind of disorder. So, thank you, Elkem, and everyone associated with this program and uh, I will now stop. So, host, you can continue with your question.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Right. So, first, understanding the seizure, you must know that the brain, how brain works. So, there are multiple electric circuits throughout the brain, and every second there are multiple like current going throughout the circuit. So, seizure is basically an abnormal electric signal that gets spread throughout multiple circuits. So what happens? So it starts from one point and spreads throughout the circuit. And what that causes, you can see that it starts occasionally. You can see the start of a like a convulsion. It starts from a hand and then spreads to the face, then legs, and generally and at last it involves the whole of the brain. So all the four limbs start convulsing. So that is a seizure. It is abnormal electric signal that causes this abnormal movement of the all four limbs and face.
What is epilepsy?
It's a diagnosis. It's a diagnosis of a disorder where the patient has two or more unprovoked seizures. So what is unprovoked seizure? Unprovoked seizure means there is no apparent trigger or cause of the seizure. Seizure can happen in many kind of diseases involving the brain, involving the human body. Like if there is infection of the brain, if there is like there is meningitis, then there is encephalitis. These all kind of infections in the brain can cause seizure. So this is in that condition, the patient will have seizure, and when the disease gets cured, they will not have any seizure. So epilepsy is when there is no apparent
What are the different types of seizures and do they affect people differently?
this is a good question. Uh, Everyone should know that seizure is there is broad classification of seizure or epilepsy, whatever you tell it, right? So it can be focal, it can be generalized. What is focal? Focal means it's involving or usually it starts from one part of body. So it can start from hand, it can stand from one leg. So the movement, the convulsion movement of it starts from a hand and then gradually spreads to same side, same side. It starts from hand, then it will spread to leg, then it to the face. So it starts from one part. So it's a focal. It's starting from a point. It's from starting from a part. And what is generalized? In generalized, the convulsion starts everywhere. So it's like a generalized convulsing movement of the all four limbs. So this is a broad term. Hence, the you can see different types of seizure in different patients. It all depends on the etiology. So this is the broad types of seizure.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Yeah, first of all, unfortunately, we cannot find cause in every patient. So sometimes we diagnose that as idiopathic. We don't know. So we, as a neurologist, do extensive evaluations in patients of epilepsy. As
Yeah.
I told earlier, that seizure can have many causes. But when I diagnose it as epilepsy, so there are unprovoked seizures going on. So to know that, we kind of do different investigations like MRI, there is electroencephalogram, EEG. So depending on that, we get some etiology. So many patients we cannot diagnose that is idiopathic, and research is still going on this idiopathic group. What could be the cause? And then there are other groups, starting from structural. So structural epilepsy means there is a lesion in the brain that is causing multiple seizures. So like it can be post stroke. Patient had a stroke and then having this kind of seizures. There can be tumors, and this tumor is causing repeatedly this kind of seizures. So these are the structural cause. Then there are genetic cause. So we have seen many genes that can cause, like there is some genetic backgrounds, and these genetic mutations causes some kind of, you can say, changes in the circuitry of brain that precipitates these seizures in that patient. So these are the genetic cause. Right, these are the broad
Okay.
terms, and there can be other metabolic disorders also. There, so these are rare, but these are the two broad and most well-known etiologies we know of the seizure or epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
As I said earlier, that the seizures can be two types: focal or generalized. See, generalized seizure is something that no one will miss. It's a very fearful, violent convulsing movement of all four limbs. So it's a very fearful condition. So no one will miss that. Now, there are some kind of seizures that is not typical of this kind of movement. See, there are some kind of seizures that there may not be some motor movements also. Like there is something called absence seizure. So what is the absence seizure? It happens in a childhood. So the parents must know these kind of things that may happen in child, and they made the what happens is the child suddenly stops interacting, or suddenly stops whatever the child was doing. He suddenly stops and just stares, and this may happen for a few seconds, and then again the child may resume their activities. So the parents or the teacher may thought that the child was daydreaming, but it was kind of absent seizure. So the difference between a daydreaming and a seizure is whenever the child is daydreaming, if you call the child will suddenly respond. So there will be no latency in the responding. But in the kind of seizure, this absence seizure, they will not respond. So whenever the parents is noticing this kind of behavior, they should call and check. So that is a one type of seizure, absence seizure. And there are other focal seizures that the patient may miss. What are the focal seizures? See, there may be there may be staring. Suddenly, the patient stares, and a part of the face just start convulsing. So that is a focal seizure, and oh, sorry. So the part of a face just start convulsing. So these are the atypical seizures that the common people should look for. So typically, the motor seizure, I don't think anyone will miss, but the non-motor seizures like this suddenly stopping, sudden staring look, or it's just a part of hand or part of face starts flickering. So these are the kind of seizures the common people should look for.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
I want to give some messages regarding this stigma. See, epilepsy is a it's a disease just like other diseases. It has the medicines, it has a treatment, It's not like there are no treatments in this epilepsy. So, but the common people, what they see, like that they see this violent convulsion happening commonly in the child. See, a child is playing in the background and they suddenly start convulsing. So the parents of other child get frightened. They say, oh, they tell their child, don't play with that child. That may spread. They actually don't know whatever is happening. So they should know what
Yeah,
is happening in that child. So epilepsy is nothing that can be spread like that. It's a disease of brain. And what I told, the etiologies, the commonest etiologies are the structural, idiopathic, genetic. So it cannot be spread like that. So and second thing is that whatever is causing that seizure or epilepsy, it has treatment. So
yeah,
we will start anti-epileptic drugs and we will titrate the dose, and it can be controlled. It can be controlled with the medicine. So a lot of patients are under my treatment and they are doing very much well. They are doing their job. But uh, if these common people when see this convulsion, they get frightened. Oh, I cannot. Like that, if this happens in a child, the teacher will say, "Oh, I cannot keep this child in our school." If this happens in an
yeah,
adult in a workplace, the employer will say, "Oh, I will not keep this guy. He may have convulsion." So this kind of stigma, not only you are creating a
yeah,
stigma that is not true, you are also you are doing a negative impact on that person. So it will cause stress, and that stress will lead to increased chance of seizure in that patient. So it's not a healthy thing to do that. You are thinking of something. You are very much justified to get frightened with this seeing this convulsion, but you must know the basics or the truth of that. Whatever is happening, at least try
yeah,
to have a conversation with that guy or the child, or the parents of the child, what is happening and how are they treating, right? And
mm,
there should be two-way conversation between the people surrounding the patients of epilepsy. I think that is most important. And I think there are lots of there as we are doing this program, there are lots of videos available for stigma relating epilepsy. So what is epilepsy? How these are affecting? So you can just see these videos. There are a lot of information in the net. You are not seeing the videos. You are just creating negative impact basis of on your own fear, not knowing about the disease. That is very bad. You must know what is epilepsy.
how does this stigma affect people with epilepsy?
Yeah, as I was telling. So whenever if like if I start from a child, the child of epilepsy, whenever the parents
Yeah,
of the other child or their peers, the parents of their peers are creating this stigma, they will tell avoid this child, that avoid this guy in the playground. So the guy
yeah,
will the child will get isolated. So that isolation will cause two types of thing. One, that will cause a depression on that child, that the
yeah,
child will feel very much lonely. And this kind of depression not only will cause a negative impact on the lifestyle of the child, it will also cause a negative impact on the growth of the child. See, as you all know right now that this psychiatric depression like thing, this can also affect the hormonal. This can also causes hormonal changes. So that will
yeah,
also impact the growth of the child. So this stigma is actually doing much harm for the child. Now coming to the adults who are actively employed in a workplace. So this
yeah,
kind of stigma will again cause isolation. This will cause depression on that guy, and this can also lead to suicide also. So this stigma can actually cause a loss of life. So don't spread and create this stigma. Okay,
yeah,
and whenever this kind of stigma, like the patients is affected by this stigma, they will stop eating the medications also. Like they will think, what will happen with that, and that will cause more seizures and more damage to the patient. Right. So this is a very that this stigma is a very harmful thing for our society, I think.
absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Right. So these triggers are very important for those. I was talking about these genetic epilepsies in the child. So these genetic epilepsies have
Yeah.
some kind of triggers. So the parents of the or the members of the family should notice this kind of triggers. So what are the common triggers? The first commonest trigger is the lack of sleep. So the lack of sleep may precipitate seizure. Right. That is a very important cause and very much avoidable cause of seizure. Next is flickering light. Some kind of flickering
Yeah.
light, like there is strobe lights. We also see that this kind of flickering light can precipitate epilepsy. So they must keep notice the parents must notice this whether this seizure is happening just after exposure of this strobe light. And then there are other kinds of mm, and as I was telling, the stress may precipitate seizure. These are other indirectly related triggers of the seizures, but this light and sometimes loud sound, but like sudden loud sound, this can also precipitate seizure. These are the common triggers, but there are thousands of triggers there for seizures. Every parent must notice, like what are the conditions after which the seizure is starting. So for that, the family members should maintain a seizure diary, like whatever the event occurred during the seizure, before the seizure and after the seizure. And
Yeah.
this kind of seizure diary will be very much helpful for the neurologist who will be treating the patient. And another thing is, I forgot to mention another thing. The family members must always do a video. The absolute, like the most useful investigation for diagnosis of seizure and epilepsy is a video of the seizure. Other things are just indirectly they will point towards the etiology, but the most useful thing is a event. How the seizure is occurring. That will be very much
Yeah.
helpful for the neurologist.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Right. Lifestyle adjustments are very much important for a patient of epilepsy. First thing first is the patient must be active. They must make active lifestyle. So that will be very much helpful to deal with epilepsy itself, and also there is some kind of side effects with medications. Every medication has side effects. So this lifestyle will helpful to deal with the side effects. And like the most common side effect of any kind of medications, anti-epileptic medications, is it can cause weight gain. So that will be harmful for the patient. So active lifestyle is very much important. Other than that, to alleviate the stress, they can do the yoga also. And another thing that is the most important part of lifestyle, they should maintain a routine. And this routine is very much helpful for the anti-epileptic drugs. So if a patient maintains a routine, they will start taking the medicine in the fixed time. So that is very much
Yeah.
important. If you don't take the medicine in the fixed time, the drug level may decrease in the blood, and that may precipitate seizure. So maintaining a routine, especially of the drug they are taking, is much important.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.